It is the start of a brand new year. Maybe you've had a good break and you're feeling refreshed and ready for the year ahead. But maybe you're not. Maybe you're coming off the rush for the festive season and you saved many lives and provided comfort to hundreds of animals and you did great things. But there's that one case that sticks in your mind like a soup bone that gets stuck in a dog's esophagus, right there above the heart. It's the case where you could have made a difference, you wanted to help, but something outside of your control made you do something that made you feel a bit yuck, deep inside the part of you that hasn't quite hardened up yet. And now, as you're coming down from that buzz of the adrenaline that keeps you going through any busy spell, you're feeling a bit meh, a bit flat. Maybe you're just tired. Maybe you think that you're a bit burnt out. But maybe you're not. Maybe there's more to it.
And that's why I think talking about the term moral injury and educating people about how it's different than burnout or compassion fatigue is so important, because I think so many veterinarians really have moral injury issues, but they say I'm burned out, or they say I have compassion fatigue. But they are three different things that we can have all at the same time sometimes, but they do have different ways that we want to approach trying to make them better.
I'm Hubert Lindstrom, and you are listening to The Vet Vault, where we occasionally stick an endoscope down your emotional esophagus to see if we can figure out what exactly is stuck there, jabbing its bony little spines into your heart. And in this episode, we are exploring the phenomenon of moral injury. You've probably heard of the term, but if you're like me, you don't know exactly what it is. Or maybe you hear the term and you think, yeah, that sounds like me. Tell me more. Well, in this conversation, you will learn exactly what it is, how it's different to burnout and compassion fatigue and trauma, why it matters to differentiate those things, and what you can do about it. Our guest is Dr. Shannon Bass. Shannon is the Vice President of Medical Leadership at VetsPets, a collaborative network of veterinary hospitals in North Carolina and the US, where she is all about mentoring hospital leaders and advancing veterinary care. With over 20 years of expertise in both general practice and in emergency medicine, she brings a wealth of knowledge and empathy for the challenges that we face as vets. And she really walks the walk. And in this episode, Shannon and I will define moral distress and moral injury, unpack the psychological impact that it can have on you, and discuss the systemic challenges in our profession, from financial constraints to time pressures, and how these put us in the path of moral injury. And most importantly, of course, we will share actionable strategies to recognize, address, and mitigate these issues so that you can keep doing what you do best and help those around you to do the same. Okay, let's get into it. So we want to talk about moral injury, which has actually been on my radar for a long time. It's something that I'm not 100% clear on what it is, and we'll come to definitions and stuff in a second. But I've heard the term and I've heard a vague explanation, and something in my head goes, "Oh yeah, I recognize that. I've felt that. I'm pretty sure I have." But before we get scientific and get into official definitions and stuff, what about examples? Is that an easy way to introduce the concept of? Give me an example of what moral injury is, and then we'll backtrack and unpack it a little bit more.
I think examples are the best way to start talking about it. And I actually have two that I'd like to run through, and they're both really extreme, but I think using an extreme example is one of the best ways to make it obvious. So the first would be in 2025, in August of 2005, after Hurricane Katrina hit the Gulf Coast. Memorial Hospital in New Orleans, their basement flooded, and their basement was where all their generators were, their water systems were. And so they lost water, they lost power. It's a multi-story, big public hospital in New Orleans that was a place of shelter. So patients' families were there sheltering with the patients. People were there that had nothing to do with the hospital. They were just in the lobby on the ground floor because it was known to be a very safe place during hurricanes in New Orleans. So there's a huge amount of people in this hospital that now was an island surrounded by water with no power, no electricity, limited supplies for all these people that were in the hospital. And so for 5 days, they were just there by themselves, and they ran out of everything. They were unable to appropriately care for their patients. And so the staff had to make some horrible decisions about who to evacuate via the limited helicopter evacuations that were available. And that was really hard because, again, there's no elevators. So if you're on the 5th floor of the hospital and you're a sick patient that's critical enough that needs to be evacuated, somehow they have to get you down. The helipad was on the roof of the adjacent parking garage. They had to get you over to the parking garage, get you back up to the roof of the parking garage to get you on the very few helicopters that were available. So who goes out? As supplies ran out, who got the limited supplies and who did they stop caring for?
Because you're too sick and, wow, that's horrendous.
And so patients died. And there are multiple first-person accounts about how overwhelmed the staff was with having to make these choices, where they knew what the right thing was, which would be to care for everyone, but they were unable to do the right thing. So that is massive moral injury. The staff felt very let down by authorities at all levels, federal, state, the corporation that owned the hospital, local hospital leaders that had to make decisions that not everyone agreed with. And so those staff members walked away from that experience with massive moral injury about knowing what was the right thing to do, but not being able to do that. The other kind of unexpected crossover to veterinary medicine is some of the staff were sheltering there with their pet. And in Katrina, people were not allowed to take their pets when they were evacuated. And so staff either had to leave their pets in the hospital, or some staff elected to euthanize their pets prior to getting evacuated at the end. So, I mean, just really rough.
Hard, yeah.
Yeah.
So, and this is where I get fuzzy about definitions, because I listen to that and I go, yep, okay, that's traumatic. And we hear about trauma and micro traumas and things when we talk about wellness and psychology a lot. So that let's differentiate that first. Trauma or micro traumas. Well, that's not a micro trauma. That's a massive trauma. And moral injury. Is there a difference? Does it matter?
I do think it matters. So Dr. Jonathan Shea is an MD psychiatrist who was one of the first people to start talking about moral injury. And he was doing it in the context of military experiences. So the definition that he has written is that moral injury is the psychological consequence of a betrayal of what's right by someone who holds legitimate authority in a high-stakes situation, with betrayal of what's right being a really key term that separates it from trauma.
Okay.
So when you think about this Memorial Hospital example, the betrayal of what's right is that these people, through the decisions of a whole bunch of other folks, right, that had legitimate authority, federal authorities, state authorities, corporate authorities that owned the hospital, there were some people that made decisions that caused this moral injury. And that's different than the trauma of, let's call it a car accident or a multi-car accident or some kind of natural disaster. That's trauma, but no one made a decision.
Gotcha. All right. So in the hospital scenario, on a normal day in a hospital, a traumatic event might be seeing the consequence of somebody drowning in the flood, or a kid comes in who's badly injured from a car crash, and that, yes, there's an emotional reaction. Whereas with the moral injury, you actually have a part in the bad thing that's happening.
Yes.
But due to a situation that's out of your control. So I know what I should do. My values say do this thing, but I can't. My hands are tied. And then there's an emotional consequence to that. Does that make sense?
Exactly. Yes.
Okay. And do they have different outcomes psychologically? Like the repercussions of the two, are they differentiated?
They do, because we struggle in the moral injury with then what decision did we make, and did we make the right one as a result of something that we were thrust into unwittingly, versus the car accident scenario or, treating a patient that's critically ill. Most of the time, if even in the veterinary space, if I'm treating a critically ill pet and it doesn't make it, most of the time I don't feel like that's my fault, right? That's because the pet came in very sick and there weren't enough things to do that would save it.
Yes. Okay. So why did you start caring about this topic? Why did you read up about it, and why did you want to talk about it?
I accidentally stumbled on a book that's called If I Betray These Words. It's by Dr. Wendy Dean, who's also a human physician. And her book is about the struggles of human physicians who were prevented from providing the care they wanted to provide because of the system in which they worked. And so she is talking about insurance companies. This is on the human medical side in the United States, where insurance companies might say, no, you can't have that surgery, or you can't get that test. Or even in large corporate medical groups where there are very strict referral rules that I can only refer to this group, but I know perhaps as the human physician that that's not the best group for my patient, but I'm unable to send them to the best provider because of these strict rules. Yeah. And so she talked about how that's such a huge struggle for human physicians when they're prevented from doing the right thing. And I really identified with that because I think veterinarians are faced with similar decisions via different routes, but similar decisions that we can't control. And I was like, wow. So she's talking about moral injury on the human side, but I think this is happening on the veterinary side. So let me figure out what moral injury is. And then how does that apply to veterinarians? Because if we don't know what it is, then we can't address it appropriately.
Absolutely. So from what we've discussed so far, I'm starting to get some clues of how it applies to us in veterinary science. I mean, the obvious one, you talked about people having to euthanize their pets in the hurricane. Well, we do that, I wouldn't say all the time, but more than you'd like, where things are euthanized, where I have the knowledge and the skills and the power to prevent that, but some factor is making me euthanize a savable animal. So to me, that's the obvious one. Does that fit? That fits, right?
That definitely fits. And like you said, we're not talking about the euthanasias of the 14-year-old Labrador you know, it has lived an amazing life and right.
Because you're doing the right thing in that. Yes. Well, at least that for most of us that aligns with our values and core beliefs. But there's others where this lovely Staffy has nipped at a child and you know, it's not the dog's fault, and now you have to euthanize it. Or obviously the big thing, money's probably a big reason why we suffer moral injury.
Yeah,
in
or
many
even
cases,
and on the euthanasia front, even I've been asked to euthanize pets because the owner's moving to an apartment that won't accept their cat, right? And then on the non-small animal side, depopulation of herds or flocks because of infectious disease, right? Like that's a moral injury for the veterinarians that are involved in that. And typically when they're doing that, that is day after day after day of sometimes really massive depopulation.
Oh, yeah. When I was finally a vet student, the guys the year ahead of me, it was the foot and mouth outbreak in the UK. And all of our older friends, you know, it was great money. They were all going there, enthusiastically employed by the UK government to work on foot and mouth. And what most of them did all day was euthanize people's livelihood, their herds of cows.
That's right.
And a lot of them are seriously affected by having to do that.
Absolutely.
Yeah. So those are the obvious ones. Are there things that you, having thought about this for a while and digging into it, are there more subtle, more insidious incidents of moral injury that we probably experience in vet science but might not recognize?
Absolutely. There are so many, honestly. Suspected animal abuse and neglect, I think, is a big part of it. And those are some of the cases that really stick with me over time, of an animal that is presented by the person that has abused or neglected it. And sometimes those people refuse the appropriate care, and you have to send that animal back home with that same person that brought it in. And I want to do better treatment for that pet. I want the person that brought it in to have some consequence for what was done. But I am unable, for a variety of reasons in all the different scenarios that this encompasses, I'm unable to actually do that. And so I just watch that pet leave. And that is moral injury. It's owner non-compliance with recommendation. And this has nothing to do with cost. For me, as largely an emergency veterinarian, this was the owner that wouldn't leave their respiratory distress pet in the hospital because they felt like the pet couldn't be without them. How many times have we heard that? And so I'm sending this labored breathing animal out of the hospital. Like, that's not right. I know that's not right. And I want to put that animal in oxygen and give it appropriate medications. And the owner is refusing to do that. And that has nothing to even do with money, right? That's just their misguided sense of attachment to that pet. Owners that, and this is often about money, but the phrase that we've all heard, all you care about is money. You don't care about my pet. You just want to watch it suffer and die. So in that situation, if we take the definition of knowing what's right, but not being able to do what's right. So I know what's right. The owner is not letting me do what's right. And then they take it a step further and they accuse us of being the bad people in the situation.
Which I think the reason that line stings so much is because it is, on the one hand, so untrue, because it's absolutely not true. But on the flip side, because of the scenario that we work in, the business model, it's a private business, it is kind of true. I think that's why it hurts extra, because you're like, yes, this is exactly how I feel. And now you're underlining it. And it is, I can't do the right thing because of money. So you're spot on, but it's not me. It's not my values. I'm not aligned with, it's the system I'm in. Mm-hmm. And we understand logically why the money is important, but I really do want to just help you.
Yes, exactly.
Okay, mid-roll interruption for some New Year's updates. I am busy mapping out 2025 for the Vet Vault, and I'd love to share with you what's been crystallizing for me around what we do here and how we do it. So, what do we do? Well, we help you find ways to have a happy, fulfilled, useful career and life where you make the most of your degree and your natural potential. Why do we do this? Because you're talented and smart, and the world needs more of that. And I hate waste, especially wasted potential. And you do important work. But as for the how we're going to achieve this, I have come to realize that there are 4 ways how the Vet Vault can achieve this. Let's call it the 4 pillars of what we do here. Number 1, education and information, like this podcast, or our clinical podcasts, conferences, and hopefully some more structured courses coming to you in 2025. Number 2, resources. So like our library of searchable show notes and our expanding set of AI tools that help you access the right information when you really need it fast. Number 3, support, like our specialist support space, where you can ask our team of specialists for case support, plus other collaborations for non-clinical support, like the Essential Consequence Management online series for team leaders that I will be hosting with Rhonda Andrews later this year. And then number 4, community, like our Vet Vault network, which I would love to grow this year, and also in-person conferences, like the first ever combined Vet Vault Vets on Tour conference, which is happening in New Zealand from 10 to 15 August. So those are a couple of the ways that we can support you right now. But now that we have the roadmap, actually, it's not a roadmap, it's more of a compass. We can build on those 4 pillars to add more and more stuff that will add value to your veterinary career. And we would love you to be a part of it. Links to all of those things are in the show description on your podcast player, wherever you're listening now, and of course at thevetvault.com. Okay, back to Shannon.
So when you think about all these things, it starts to open your eyes to how many experiences veterinary staff, both veterinarians, technicians, receptionists that get yelled at, how many times veterinary staff is exposed to, these are not moral injury events that are on the level of perhaps the Hurricane Katrina example. They're not that extreme, but they're happening every single day.
Yeah, and it's cumulative as well,
yes.
Like you mentioned. Yeah.
Yes.
So just to be clear on the one factor, so when we discuss the definition, it's always, you can't do what you want to do because of some external bad guy.
Essentially.
And I'm trying to identify the common stumbling blocks, the roadblocks for us in veterinary science. So it'll be, so we said client decisions or client thinking or attitude. Money is a big one. And I touched on it before, the systems that we operate in. So it's the boss. And again, it's not because the boss is a bad guy, but there's other realities of veterinary practice. It's a business that has to generate a profit.
Right.
And the other thing that we haven't mentioned as well, time, because you talk about not providing the care that you want. And I've certainly been in instances where things go wrong and, you have a patient die who's in ICU or something. And there's a lot of guilt because you go, oh, I did not spend enough time with that patient. I wonder if I could have prevented this if I wasn't running around like a headless chicken with 10 consults an hour, or, it's those nights where everything is crazy and the ICU is really busy, and you know that your level of care per individual patient is not where you want it to be. And it's, again, it's nobody's fault really, but you sure feel the guilt. I've seen nurses get hit really hard by scenarios like that where they feel, I didn't do what I was supposed to do.
Yes. And I absolutely think, especially if that is truly you're short-staffed, and maybe it would get closer, I think, to the definition of moral injury if maybe hospital leadership said, no, we're not going to hire you that extra ICU nurse that you've been asking for 6 months. You're going to have to make do with what you have, right? So that is, you're in a situation that you knew you needed an extra ICU nurse. You were told you couldn't have them. I think if it's a particular nurse called out tonight because their child was sick and you're short-staffed, I think that's a little harder to say, are we fitting into the definition? Because you're not really being betrayed by someone, right? You were just, if the nurse called out and so you were short-staffed and a patient died, those are bad circumstances, but I don't know that that rises to a moral injury. Does that make sense?
Yep. The other term I've come across is moral distress.
Yeah.
Is that the same thing? Moral distress versus moral injury? Same?
So interestingly, there are some folks in the moral injury conversation that really feel that the term moral injury should be reserved for military experiences. And so some of those people have suggested moral distress as a similar term that might be applied to non-military environments. And moral injury really did originate in the military space, about people that were given orders that they disagreed with, but they had to go out and fight battles with those types of consequences, and they didn't agree to do that. And so there are people that argue that moral injury only applies in those environments. There are just as many people who argue that one group can't
claim a psychological condition.
Can't claim a psychological condition. So I think, some folks would say there's a continuum of something that might cause moral distress that isn't quite rising to moral injury. So I think those terms are, I don't use them synonymously. I kind of use moral distress. Actually, one of the things that I have thought about as moral distress is I had an experience personally one time where I was going to work, and this was when my children were quite small, and one of them said, "Can't someone else take care of the animals today?" And that, sometimes we call that mom guilt. I also think there's some moral distress there about, I'm the only one on shift. Like, the right thing to do is for me to go work, right? But my child is also asking in a way that just really tugs at my heartstrings. That's not moral injury, I don't think. But there's some distress about, like, what's the right thing to do here?
Yeah, for sure. I never thought of that one as well, but that's a very common scenario. We certainly went through that as well as parents. So it feels to me like I'm developing a picture in my head. It's, I want to be here. My soul wants to be here, but something's dragging it over there, and it creates that tension.
Yeah.
And it just puts your morals under stress, under tension.
Right.
And at some point it can snap almost.
Well, and I think if your day starts like that, right, with your child saying, "Can't someone else take care of the animals today?" And then you get there and that owner tells you that all you want to do is watch animals suffer and die. And then someone else tells you that they're not going to leave their labored breathing pet in the hospital. That's where I think this becomes very cumulative.
It's interesting. I don't know if it applies, but I'm reminded of a conversation I had some time ago about compassion and empathy. So people talk about compassion fatigue, and there's a theory that says it's not actually compassion fatigue, it's empathy fatigue. I feel too much. And I got down a bit of a rabbit hole on that topic. And I'm trying to remember so compassion, seeing a problem or seeing pain and being driven to want to fix it, that's compassion. And then actually acting and doing something about it. And that's a really positive emotion. But then anything that prevents you from doing that. So you feel compassion, I want to act, and that positive emotion then switches to a negative again because it becomes empathy fatigue, empathy burnout almost, where I have this desire to help and I can't because of X. And they've proven this with studies, with brain scans, that it shifts. Literally, those emotions shift from a place of positivity in your brain to feel good areas to really where you have that, I start feeling the pain that the patient that I want to help is feeling. I feel like there's a definite overlap there with that.
100%. And that's why I think talking about the term moral injury and educating people about how it's different than burnout or compassion fatigue is so important, because I think so many veterinarians really have moral injury issues, but they say I'm burned out, or they say I have compassion fatigue. But they are three different things that we can have all at the same time sometimes, or we might have two of them, but they do have different ways that we want to approach trying to make them better. And so if we don't know that moral injury is an issue, and if I say, okay, I'm burned out, right, which is defined as a state of emotional, mental, and often physical exhaustion brought on by prolonged or repeated stress, right? So that's burnout. So if I'm burned out, I probably need to change my schedule. I need to figure out how to rest. How do I give myself some more time because I have this fatigue and exhaustion because of prolonged stress? So if I just rest and change my schedule, but I'm also suffering from moral injury, there's no amount of rest and changing my schedule that's going to help me deal with my moral injury issues.
Okay. That makes sense, because I often wonder, there's all these terms, but why do we have to differentiate so carefully? But that makes a lot of sense. Before we get into what do we do about moral injury, how does it manifest? What are the clinical signs of somebody who's like, because I feel like, okay, when this happens occasionally, you have an inherent resilience where you go, yeah, that sucked. And then you come home and you get through it, and the next day is a fresh day. If it doesn't happen for a while, it's not an issue. But if it becomes an issue, what does it look like?
And I think that's the hard part, is that it looks a lot like, a lot of these have very overlapping symptoms, right? That depression, anger, withdrawal, dreading going to work is pretty common. Not wanting to share with other people. And moral injury is really specific about that. You have stories probably, and I have stories that I don't share with very many people. Because if I told some of my horrible stories to just a random person that I end up sitting next to on an airplane, they would be horrified, right? And so then you withdraw. And so you stop. If you have enough moral injury and it's significant enough, then you stop sharing, because you're not really sure what you can share and what you can't, and how people are going to react. And so then, we end up in this place where we're isolated and we're not connected with others. And that's where really bad things like suicidal ideation and things like that can start, because our brains start to tell us that we're the only ones that feel this way.
Okay. You sent me an article, like a proper research article on moral injury. What caught my eye was PTSD. Mm-hmm. It's quite closely tied with this. Is that correct? Did I get that?
It is. The difference being the betrayal piece, right? Because PTSD, I'll just keep using the car accident example. A lot of people have PTSD after a really significant car accident where they would relive those moments, and it would bother them and it would be hard to get over. But if you're in a really bad car accident, that is a traumatic experience. But no one had that betrayal piece where they made a decision that really affected you. And even if, let's say, you were hit by a drunk driver, you can be really angry at that person. Mm-hmm. They made a bad decision, but there wasn't a systematic or systemic betrayal that happened.
Systemic betrayal that kind of forced you to betray yourself in a way.
Betray yourself, right? Because you were just driving down the road and the drunk driver ran into you, right? And so you didn't make a decision there that you might question, should I have looked left sooner, right? But that's a different thing.
This is it's a heavy topic, because when you highlight the details like that, I do go, okay, wow, this is actually really common, and a little bit concerning and a little bit of a downer to go, well, this is kind of baked into what we do. We're not the only profession. So what do we do about it? Can we fix it? Can we make it better?
I think that we can. And I think the biggest thing is is really to understand we can't stop it because I can't control other people. I can't control all these decisions that clients make or that maybe even my hospital leadership makes or things like that are going to cause me to be exposed to it. But I do need to know that it exists, and I need to know that it's different than burnout and it's different than compassion fatigue. And so those are the most important things, because our brains naturally, we want things to fit into a paradigm, right? And so if we don't know that moral injury is a thing, then we're kind of doing a square peg and a round hole exercise of trying to say, this is how I feel. And if I incorrectly name it as burnout, and so I change my schedule and I go part-time and I rest and I meditate and I'm not feeling better, then I'm lost. Mm-hmm. And so knowing that moral injury exists is a huge first step in order to be able to make a plan. Then the two people that have done the most research on this, Jonathan Shea, who I mentioned earlier, he's a MD psychiatrist, and Dr. Brett Litz is a psychologist that's really active with the Veterans Administration. Both of them agree that the best treatment for moral injury is to be in community and talk about it. Right. And that we have to do that with people that understand. So it would be a group of veterinary staff, a place where I can share those stories that I am so reluctant to share, and a place where they understand and they're not going to think that I'm a bad person because of the decisions that I made, and that they can be in community with me. And people really agree that that's the biggest and most effective treatment for moral injury.
Which is, it's a bit twisted that the thing we have to do is the thing that we feel like not doing because of what's happening to us. So that's you feel, right. Because you feel, you talk about guilt or betrayal, you feel self-betrayed, and there's a lot of guilt associated with that. And often, I think because you feel a bit sick about it, you go, I don't really want to relive that. And I don't really want to tell people about it because I feel yuck about it in myself. So people are going to judge me and think I'm a bad, what, you did what?
That's right.
And as you say, a general member of the public or a friend, you tell them that and they either brush it off as, oh, it's not, they don't really get it, or they think you're a weirdo or a
100%. Yeah.
Wow.
The other thing that we do really commonly as a defense mechanism is we bash the client. Mm-hmm. So instead of thinking about my feelings about that respiratory distress dog that was taken away from the hospital, I just stand in the treatment area and I bash the client that took their pet away.
Yes.
And that makes me feel better in the moment, right? Okay. But what I just did is put a bunch of negativity out to the entire team. And I didn't actually address how I felt about that.
So you're lashing out, really. You've identified the cause of your emotional turmoil.
Right.
And then you bag it, but it doesn't actually fix anything. Actually, it makes things worse, because you're right. That is a very quick way to ruin the mood in a vet clinic, is some good old client bashing.
Yeah.
And then before you know it, everybody's negative.
We do it all the time. And it's it's an easy defense mechanism to jump into, but it's not helping at all. And so in reality, the more healthy response, even in that moment, would be to turn around to my team and say, that makes me so sad. And I feel so ineffective because I was not able to convince her that she needed to leave that pet here. And all I can sit here and think about is that dog can't breathe. And to have my technician say to me, I feel exactly the same way. Thank you so much for saying that. And then we have that moment where we all acknowledge how bad that felt. But we also acknowledge that we didn't do anything wrong.
So it's vulnerability in the moment and beyond, to be able to be vulnerable with what you're going through, with what's happening, and then also how you're feeling about it.
Right.
Is it just, does that, I wonder how that works. Is just at least clearing the slate a little bit, offloading it so it doesn't just become that baggage that weighs you down.
And I think if we got good at doing that in the moment, we really would unload some of that baggage. And we would give that gift to all of those people around us who would jump so quickly onto that bandwagon of, yeah, that was hard. And that would be a much more lasting, positive emotion rather than, can you believe that woman? And she's so stupid, and many of the things that we more routinely say.
People suck. I hear that. People suck all the time. And so here's a question. Do you know, is there any data or any of the research that shows that rationalizing things can help? Because in that scenario, the client that makes a decision that I don't agree with, or the client that has done something that's led to a consequence that makes me angry, and then I will feel that the desire to bash and to get angry. But what I found over the years is if I stop and rationalize it and try and apply a little bit of empathy to the client, and it's not that I don't feel for them, but at least I can, what they call cognitive empathy, where I can put myself in their shoes and go, okay, I'm so angry or so sad or so upset about this situation, but the client's only human. I get it. They don't have money. I don't understand their situation, so I don't know what's led to their bad decision making, but I'm sure they're trying to do the best that they can do. I feel like that sometimes lowers the tone of the emotion on my side. Is there anything that shows that helps?
I can't say about the research. That's not something that I have looked into, so that may be out there. But I agree with your assessment that assuming positive intent is incredibly powerful. And assuming that this woman has no interest in making her dog suffer. She just has, for whatever reason, her own blindness to the situation that I can't control.
And I find verbalizing the rational reasons why the situation is so shit helps me as well. So let's say it's money, or it's a managerial decision or something. And then again, that emotion comes up. If I then stop and sometimes verbalize to somebody else, let's say my colleague's really upset about something, to say is, yeah, but I understand that this is why it has to be this way. It sucks, but there's no malice implied by anything. I do feel like if I can find a reasonable explanation in my head for why it has to be that way, it again lowers the tone for me of the...
Well, I do think it helps to differentiate things that are just unfortunate circumstances, right? Like the technician that called out because their child was sick and there was a consequence. Like that's an unfortunate circumstance that harm maybe occurred, but no one really did anything wrong. Yep. It was an unfortunate circumstance versus someone that is intentionally...
Okay. Gotcha. Yeah.
Doing something.
So when there's no rational explanation, where you go, right, this is just stupidity, or as you say, it's management trying to be greedy, or the client with the fancy BMW outside who says I can't afford the cesarean section and I have to euthanize.
That's harder. Sort of that's harder when you feel like somebody there's an unspoken agreement that we have here, and you're betraying it.
Okay, so it's betrayal of trust. Is a key factor. Yeah. You're right. When I think about that, that makes a lot more sense. So Shannon, for you guys, you are the helper and the fixer for vets in 30-something clinics. How do you implement what you know where you work? Because we are beyond educating. So saying, all right, you guys need to talk to each other. You need to offload these emotions. Otherwise, they're going to start drowning you. Do you have a system for it, or do you have any suggestions?
I'm really starting to talk a lot about the client bashing piece, because I think that's the fastest, like in the moment way for us to recognize the minute that I want to start client bashing, I probably need to examine what my real emotion is. And so really started to talk to veterinarians about that, and staff, right? Because staff are great client bashers too. This is not just a veterinarian opportunity. And so really starting to use that as the minute I want a client bash, can I think twice about why I want to do that and instead talk about my emotion? And what's pretty interesting is vets that I've talked to about this that have experimented with it, and they do see the difference in the room about how the room changes when they're able to do that.
Okay. And then out of the moment when it happens, post-work week, having somebody to connect with and talk about, as you said, your mates don't want to hear about this. Have you guys got anything in place for that, or because I'm just trying to think how could you fix this, having a group of trusted people who you can discuss this with, which we don't all have, to be honest.
No, a lot of us do, and we don't even know it though. Many veterinarians are part of online groups on some platform or another that are only veterinarians.
Mm-hmm.
And so many of us do have veterinary only spaces where some of this could be discussed. So that's an option, right? The other is there's an amazing group called the Veterinary Hope Foundation, and they do offer 6-week programs where groups of 8 veterinarians meet once a week to share on any topic, but this could certainly be the type of thing that would be shared. So and this is all free, the Veterinary Hope Foundation. And so they do really impressive work. So that's a group that's focusing on groups of veterinarians meeting together in small cohorts to work through some of the things that they're experiencing. So that's something that's organized, but I also think it's something that could be easily organized within an individual practice, no matter how many people, even if it's a single vet practice, once a month they could sit down and have a conversation about these topics. And even though it's tough, like you said, we don't necessarily want to relive that most difficult case over the last few weeks. It's an important thing to sit down and talk through what our actual feelings are. So small practices can implement this, big practices can implement this. It doesn't cost you any money. If you want to, everybody bring your lunch, and on the 4th Thursday of the month, we're going to eat lunch together and talk about this.
I'm trying to think for myself, and it's interesting why I feel this. Part of me goes, I think I'd rather do it with people who I don't work with.
Interesting.
Maybe it's a bit of ego. Or maybe it's that vulnerability piece. Maybe I'm not that comfortable being that vulnerable with people. I feel like it'll be almost downer sessions, like a bitching session. Let's talk about all our problems with my colleagues. Whereas I want a positive workplace, but that's. I wonder if I'm the only one who feels that way. So when you talk about the Hope Foundation, I like the idea of saying, okay, there's these other people.
Yeah,
I don't have to see them again for a month, and I can be really open, and I can really share, and I can cry if I want to.
Yes, understood. I do think if it's in an individual hospital, you would need someone that had a pretty high level of emotional intelligence to be leading that group, because you would want to steer it away. Like, we don't want to start with I'm feeling vulnerable and move into client bashing.
Yeah.
So someone would need to kind of lead and steer that group.
Client bashing, and then I worry that it will turn into a potentially leadership bashing or problem solving session to say, well, how can we prevent it? It'll turn into a meeting instead of just a conversation. And
it needs to be a conversation about, like the example I gave, like, that made me really sad. All I can think about is that dog that can't breathe. And all I need you to say back is, yeah, I feel that way too.
And I think I can think of a very specific example where that did work. I did it accidentally, and a massive difference immediately. It was an early morning, dog in labor, where it was a young client who was obviously just clueless and had left the dog in labor for 2 days, and she came in on death's door. And I remember this overwhelming fury at this guy, and coming out the back, and the nurse I could see she was the same. We were both, there was a massive tension. And for some reason, I just was honest with her and said, I'm so sad. I'm so upset. And it helped. It definitely made a big difference. I remember driving home going, wow, normally I would be in such a bad state of mind after that consult, the last consult for the day, of course, for the shift. And I didn't. I felt a sort of a lightness in spirit for having that moment with the nurse where we both just said, yeah, that sucked.
Yeah.
So yeah, it helps.
It does. It really does. And there's a great phrase that I have come across in some of the reading, which is, a problem shared is a problem halved.
Mm-hmm.
And I think that's a very simple way to talk about how that sharing makes the problem feel lighter.
And there's science behind it, because it's one of those things that your gran would say.
Yeah.
But you can say to your gran, no, there's actually data that says that this is true. I like it. Because it feels too simple.
But it's the thing.
But the scientist in me goes, no, there's got to be more. I've got to do some exercise and maybe take a medication or something. Just saying, yeah, talk to some friends about it. You'll feel better. It seems too simplistic, but it's great that it's so simple.
Yeah. And there's so many ways to do this that are effective and easy. And we often too overcomplicate our solutions, I think.
Yeah. Wow. Shannon, is there anything we're missing out on? Or do you think, I feel like that's opened my eyes and hopefully people listening as well. Because you're right. The default is to go, I'm burnt out. That's the, and I'm sure that's how you feel, but maybe if there's one message from this is to say, well, be specific about how you're feeling. I have strong negative emotions about work. Try and put your finger on it. And then when this is an easy enough thing to say, well, maybe it's this. It's yes. If I think back to the month preceding how I'm feeling now, I have had a lot of that. And and it's such an easy strategy, right? It's not like I have to do anything dramatic to say, well, let me see if I reach out to a group and if this does help alleviate what I'm feeling. As you say, because there's often multiple of these things happening at the same time.
Yes.
Well, address this one, cross that off the list, treat and see. One of my medicine lectures used to say for your patients, treat what you see and then see what you're left with. Well, treat this one and then see what's there after.
I think that works. I think that absolutely works. And, if we're feeling burned out, it's never wrong to do the steps for that too, right? Like change your schedule a little bit, take some time off, do some of the mindfulness things that we know are really effective. There's all kinds of strategies that are going to help. But if we just do those and we don't examine this moral injury piece, then we're not really going to feel that much better.
Cold. Okay. Are we done with moral injury?
I think so.
You're not going to get away without these standard questions. So, podcasts first. Do you listen to podcasts?
Yes, definitely.
With all the stuff that you do, because you're like a super endurance athlete as well, aren't you?
I do a lot of endurance stuff too, yeah.
What do you do?
So I really love adventure racing. Do you know what that is?
Yeah, I think I have a pretty solid idea. Is that where you torture yourself for days on end, running and cycling and kayaking?
That's right. Yes.
Okay.
So it's map and compass navigation and mountain biking, hiking, and paddling. And the winner of an adventure race is the person that gets to the most checkpoints in the least amount of time. And I like to do these on all female teams, which is pretty cool. Historically, this has not been an all female kind of a sport. And so it's really fun to get out there with a group of women, do some cool stuff in the woods.
Wow. Okay. So the reason that came up, I was going to ask, when you are training for these things, do you listen to podcasts?
I do. Yes, for sure.
So what's high on your playlist at the moment?
So I love one called the Veterinary Life Coach podcast with Dr. Julie Capel. She's also written a book in the last year or so. And I love the way that she approaches things because her approach is all about you can love being a veterinarian. And she helps people move towards that, which I love.
Any non-vet stuff that you listen to?
I like military history a lot. So I tend to listen to some things like that for sure. And there are adventure racing podcasts. And so if I'm preparing for a big race, then I will listen to a lot of race directors will do podcasts in front of a race. And so that's kind of required listening because they might give you little clues that will help you to prepare better.
All right. Books. Anything that you've read recently that has changed the way that you think about the world?
So Kristen Hanna is an author that writes historical fiction. And I read one of hers recently that it's called The Four Winds, and it's about the Dust Bowl. And it's fiction, but it's about the true Dust Bowl that happened in the 1930s in Oklahoma and Texas. And a lot of folks migrated from those areas to California, and they were treated absolutely horribly. And it was fascinating to think about our migrant issues that we have in the world today in 2024 and read about very similar issues that happened in the United States in the 1930s and how history repeats itself. Is
Steinbeck's Grapes of Wrath set in that's the same
setting,
same period, right? Same setting, which is also not a fun book.
No, and this one ends well. Kristen, it's historical fiction, right? So she needs it to end well. But it was really enlightening.
Okay, pass along question. So the one that you are landing with. So this is a previous guest has asked me a question, not knowing who it's going to be for, and he asked, if you had to knowing what you know about the vet profession, if you could start completely fresh and redesign the whole profession, so burn it down, burn it to the ground, and rebuild it in the way that it should be, what are some changes that you would make? It's a big question.
I know, this is what I was really glad I had a day to think about. But I did come up with an answer that I'm happy with. I wish we did way more education about how to run a small business in veterinary school, like a lot of it, not like the one semester class that I think they get now. I got none in vet school in the 90s, right? I think now they're getting some, but I wish we did a lot of it, because I wonder how our landscape would look differently if veterinarians had been very well trained in business for decades. What would our corporate landscape look like? How would it be different? And so if I had one thing, if I could go back and do it all differently, and I was the only one in charge, I would do a lot more business education.
Yeah, that's a great point. Because you're right. We did one Friday afternoon in a 6-year program.
I will never forget a lecture in 3rd year. I went to Texas A&M, where the speaker spent an hour talking to us about how we needed to wear ties. Obviously, the ratios of vet students were different at the time. But I mean, there were a lot of women in my class. And I was like, for real? Like, we're still sitting here listening to a lecture for men and about men's attire?
Wow. So it's changed, as you say. You wonder, because the limitation there is you have X amount of time to get all of this clinical vetting stuff into your skull. So the pushback would be, how do you fit that into the program? You wonder almost if you could have a specific veterinary business degree for not necessarily the doctors, to say, well, have people who study that, to say, well, I want to be a vet practice manager, something like that. But yeah, okay, great answer. I like that a lot. Your question for my next guest, please.
So I have a signature question, so I didn't have to think about this at all. Cool. And I ask people all the time, everywhere that I go, tell me something you learned today.
All right. Last question. Our wrap-up question is always, you have the opportunity to speak to all of the veterinary new grads of the world. Maybe you're on a podcast and you have a couple of minutes to give them just one little bit of advice for their veterinary careers. What's your bit of advice?
Do not be afraid of your clients. The clients have the answers to all of the questions that you need to solve your case. And if you are afraid of them and you avoid talking to them, you will miss out on essential information and you will make the wrong diagnosis and it will all be harder. And I know you're terrified to go into that room and talk to them when you are not sure what's wrong with their pet. It's okay to not know, and it's better to ask them the questions yourself and be in relationship with the owner of the pet.
I love that one, because you're right. There's often a confrontational vibe of us against them, and they're the stumbling block to the answer. But no, they're the key to the answer. You're on the same team. You want to do the same thing in the end. You maybe have different opinions on how to get there, but you have the same goal.
I see so many early career veterinarians that use the technician as the go-between, and they keep sending the tech back in to ask the owner more questions. And it's all about fear, that they're afraid that if they go in and the client asks them a question that they don't know the answer to, they don't know how they're going to handle that. And it's okay to just say, I'm not sure. I'm going to look that up. I'm not sure. I'm going to consult a colleague. Let's wait for that test result and then we'll talk more. There are all kinds of great responses when you don't know the answer, and it's okay.
Shannon, thank you so much for spending the time with us. Thank you for suggesting this when we met over a coffee at IVEX. And I'm so glad you read that book that sent you down this whole rabbit hole, because that really was eye-opening. And I think it will help anybody who listens. Have you found, talking about the topic in your hospitals, that you're getting good feedback, that yes, actually recognizing it, because it's self-awareness, right? It's
yes,
being aware that this is, something's happening. A, recognize that. B, oh, I think I know what it could be, and let me act on it. Is it helping? It's
very eye-opening for people. Most people haven't heard the term, and so it's very eye-opening. And everyone that I talk to about it's like, yeah, that's happening.
And I felt that having this conversation with you. I've heard the term, but I wasn't clear, and I felt that a little bit of a light bulb going, oh, yeah, that explains a couple of things. Well, thank you so much for sharing it with us. Appreciate the time.
Thanks for having me. I've enjoyed it.
Right. It is time for our end of episode humble brag, where I share my favorite VetVault review of the week, overlaid with some inappropriately dramatic music. I do this for a couple of reasons. Number one, to publicly thank the people who do take the time to review and like what we do. It really means a lot to me personally, and it keeps me motivated to make something useful. So, thank you. Number two, to remind you to please leave us a review or a star rating on your podcast player of choice, because when you do that, you tell the Apple and Spotify algorithms that this is a podcast worth listening to, so it starts showing it to more people like you. Number three, the dramatic music is mainly because my editing software has this vast library of music that I never get to use, and this gives me an excuse to have a bit of fun with it. So, review time. Short and sweet, but really lovely. Michelle writes, compliments of the season. Compliments of the season to you too, Michelle. I found the free podcasts, which you did with Gerardo Polly, and subsequently subscribed. Smart move, Michelle. Thank you. I thoroughly enjoy the content and particularly like your humor and humility, saying when you don't know something and clarifying points from the perspective of a GP vet. Keep up the good work. Thanks, Michelle. I promise that I will keep up the good work, and rest assured, I've been doing this for many years now, and it seems that there is minimal risk that I will ever get to the point where I do know so much that I no longer need to ask my questions. Okay, thanks for listening. We'll see you next time.